All right, everyone. This is really just a discussion about our beta program with Humantiv, and it's really just a Q&A, like problems that you're having, that we're all having. Let's just talk about them, walk through them. We're all going to be documenting this. Megan, Bill, myself, we'll be documenting this, and we'll be putting all these stories together in support tickets in Jira, so we'll be able to work through. And Bill will be working through these over coming weeks, coming days and weeks. So I guess starting off, can somebody just give some feedback on just the whole experience of Humantiv, the struggles you're facing, kind of like starting from start to finish? Well, there's no finish, but starting off and just the whole progression of how you feel about
it. If you want, I can go
Sure.
first.
Yeah,
I'm trying to think. So what was it? What day did it get released? I'm trying to think now.
It's been live for 8 days. It was
last 8 days, yeah. So I downloaded it right away in test flight and was able to sign in and nothing showed up. It was blank, everything. And tried signing out, reloading it, everything. Had it set up so that it would be Apple Health, connected with it, and nothing showed up at all. Then the new build I would get a notification that there was a new build ready to download. I'd go to download it and it'd say the build was gone and it wasn't available anymore. And I'd emailed Megan, and she was going to go ahead and re-register me. And then what I did was, just on a whim, when I logged out again and I logged in with Facebook, and all of a sudden it started working and started populating. So I don't know what that was, but now it's been working and the builds have been loading, and I'm getting my Medit every day. So
I'll piggyback on some of that. I think that a lot of what we both experienced, because I had similar experiences, Kim, a lot of it has to do with test flight, and there's a lag. A lot of it, apparently there's a lag between when you get the email and the bill's actually propagated out. So patience is key, and I think it's because Apple has a lot tighter control over what developers do, which can be good and bad. But I'm in the same situation that it's working great now. The bill's made some cosmetic changes as well. And I think I had a recent issue where it wasn't updating. I just rebooted the phone. Who knows? There's just some tricks you can do. But again, we're talking about a beta. So
right, exactly.
I think in reality it's working well, and it's only going to get better.
Yeah, for sure. I have noticed that it doesn't update unless I actually close the app out all the way, like swipe up on my phone and close it.
Right.
Then when I open it and it launches again, then it updates.
But that's all, again, part and parcel of betas, and patience on both ends. Patience with Apple and patience with the app.
Yeah, for sure. Yeah, and I mean, I've done beta testing before, and so, it's all trial and error, and kind of so. But I think I like it. It's fun, kind of having the Medit show up, and so.
Now, do you mind if I ask a question, please?
Sure.
This is my first time beta testing something of this sort, and I'm not sure what I was supposed to expect. I mean, because I've only used things like this where it's fully functioning already. So I've gotten my Medits, I've updated as it came out, and I haven't had any issue, and I'm using the same Apple Watch functionality. So I guess, am I supposed to be expecting more? I mean, I guess I don't know what I'm supposed to be looking for. So I don't know if maybe mine is functioning or not at the same level. I've also been having Wi-Fi issue. I'm having my them come out to fix it. So I noticed that like some things aren't transferring, but I think it's more the apps I'm using on my Apple Watch and phone. Those things don't transfer over that data, but other than
Not
that,
yet.
it's more functionality that way.
Not yet, they don't. And I know that Nabil's working on that, specifically like activity minutes.
Right.
Don't come over from Apple Health like they do in the Google side. If you look at my wife has an Android phone, and she's on Humantiv, and her activity minutes show, but there's an interface issue that I know Nabil's working on diligently. Soon we'll have that activity minutes for us Apple aficionados.
Yeah, I thought that was more of an like OS and an interface thing than the actual update itself.
Yeah.
Right now in the beta, so I just wanted to make sure it wasn't me just expectations with beta than things. Like, should I be looking for something that I'm not right now?
No, really what we're doing at a core level right now, we're allowing people just to connect their wearables and generate a health score and generate Medit. That's really what we're working on now, is getting that functionality down, getting this health score more refined, where it does calculate your activity throughout the day, your steps a little bit better, and generate Medit for you. So that's kind of the core of what this beta is, and kind of working around all the both sides of that, the onboarding process, and really just the flow of the user interface and the user experience. So that's kind of what we're doing now for the beta test. There will be the next second and third phase. We'll be adding in more data points, such as a wireless blood pressure cuff, wireless scale, and other types of wearables, and start adding more data to your health score. So start
Genomics.
that more, get it more accurate.
Well, in that case, mine's been working like seamlessly.
Yeah.
Like,
That's good. Yeah, don't look for problems. They'll show up by themselves.
I just want, yeah, exactly. I just wanted to mention then that mine's working seamlessly.
That's great.
Good deal. And let's see here. There's a lot of little bitty things that always need to be cleaned up, but that's more of just the user experience and some graphical issues. What I will say here, let me see. I don't know if anybody noticed this, but there is a chat dialog in the upper right-hand portion of your screen.
Yep, I used it today.
Yep. And moving forward, any feedback that you have, please just click that and you can chat directly with us. So you can just take a screenshot and then send it to us directly. And we'll have just an ongoing dialogue with you about this. And the same account, you'll be using this with all of our products, because this is actually intercom. You know, like you go to a lot of websites, you have a little intercom chat option in the bottom right. Same thing. So we'll be using this for Humantiv, Metaplex, and everything we have moving forward. So we'll have a record of all these conversations with you.
And there is no bad feedback.
Oh, yeah. If you don't like the way something looks or something's buggy, please tell us. Because there's so many different devices out there. Sometimes they're updated to the latest operating system. Sometimes they're a couple versions behind. There's just a lot of variance in products. So let us know specifics, what you have, what you're using, and go from there. Also, let me ask anybody, does anybody have the text on your phone increased? Like as just a default? Because I did notice that in the bill. I haven't mentioned that, but if somebody does increase the text or the font size, it messes with all the text in the app.
Yeah, that's exactly what my problem was.
Oh, maybe mine might be increased.
Okay. Yeah, I noticed that. That's John. That's what I noticed in Houston.
Yeah. Yeah, I remember you bringing that up.
Yeah. So in the bill, I'm gonna leave I'll make that a ticket or a bug.
Yeah, accessibility.
Yeah, that's right. Accessibility. Yeah. All right. Well, I will say what we're working on next. If you go to the wallet screen, let's just kind of walk through what we see here. On the wallet screen, or just in the upper right where it says invest, if you are curious about what that is. Humantiv is part of Citizen Health. We're having multiple platforms that we're developing. And if you click that, it's going to go to our current crowdfunding campaign. It's an equity crowdfunding campaign. And you can invest in Citizen Health if you want to. So that eventually this will show your Medix balance, which is our shares of our company that are tokenized. So a really cool concept, and it's made possible by the blockchain technology and what we're doing now. If you eventually, when you purchase these in our investment round, they will show up here in your wallet. So you'll be able to do special things with that will enable your voting capabilities. So when we do have ideas and proposals that we're trying to vote on with Citizen Health, different apps to build, different directions to take, you will be able to vote on that. So that's what that is, if anybody's curious. And also, let me see, on that wallet page, share and earn free Medit. Pretty straightforward. You share this with your friends. You can share it on Twitter, LinkedIn, wherever you want to do it. It's a standard sharing feature. You share that, you earn 10 Medit. We will be limiting this to only a couple shares a week right now. Don't get crazy with it and click and share 100 times a day. We're just testing the functionality right now. So, but that is welcomed. If you do, we definitely welcome you to share this with your friends. Anybody that you know has a wearable, please share it with them, because this is just a way for them to generate Medit and then to be able to spend their Medit on health and wellness products and services later on. So the more the better. And also on the market, if you're curious what that is, it says coming soon. That is going to be Metaplex, our health and wellness marketplace. We have a lot of plans for this. I will say initially it's going to start off pretty simple. We are going to be selling Fitbits, Apple Watches, different meal delivery service, subscriptions, vitamins and supplements, basically anything you need around health and wellness. We're going to be selling on this marketplace. And you'll be getting discounts. We're going to be starting an affiliate program where we already have with a lot of these companies. So you'll be able to get 8 to 10% off on a lot of on an Apple Watch or a new Fitbit, which is pretty cool.
And that doesn't happen very often.
No. I was really surprised by this affiliate part too, because you can get a lot of deep discounts if you just resell other people's product. And we're going to be focused on the really high quality products too. So you'll be able to take your Medit almost as a discount token to be able to get discounts, 10, 20% off certain products. So it's almost like a credit card. You get your credit card points. You use those points for a discounted airline ticket or something. So the same concept.
Brennan, I want to share something on this screen here. If you see the screen, the dot on the side towards the steps, it's kind of not hitting the margin. I don't know why. Is that telling me something, or is it a way? Did you see that?
For the steps? Yeah.
It means that you didn't reach your 10,000 steps yet. If you go down.
So, okay.
That's a pretty simple answer. Mine's the same way.
So right now we have some arbitrary limits for the health part. So that little dot for each metric, and in the future it's going to be things like blood pressure, etc. If it's within that green circle, it means that you are healthy. And if it's outside, it might mean that you're under or over the healthy, the healthy part. So it's not really very well explained right now, because we have just 4 metrics, heart rate, etc. And in the future, what we want to do is basically personalize that also for you, like depending on your physiology, your body, the way you exercise, the journey you're taking, it will be personalized for you. So your healthy limits are going to be different from somebody else's healthy limits. And the idea is basically to be green all the time and to have the high score and keep earning.
So your dots have to be in the green range.
Correct. Yeah.
And we've been checking on you too.
Yeah, especially the doctors.
I know. Right. I just say I act like one, that's all.
So will people with chronic illnesses, will those things be taken into account? Because like right now, my health score is a 16. I hit green on my heart rate once because it was slow enough.
It will eventually. I mean, it's beta, which pretty much everything is standard. But the whole idea of Humantiv is to choose a journey, and that journey can be, you already are an athlete and you want to just perform, or you have, you have a chronic disease, or you're coming from a surgery and you want to get healthy. And the idea is basically to compete with yourself. Your some effort that somebody who has a chronic disease are higher than some of the efforts that somebody's going to do when they're performing at really high standards. So how do you balance all of that? It's what we're working on, and how to get things fair, for everybody.
I was going to ask that, is there going to be other options for your journey? Because I put something about my grandkids and I do not have grandchildren.
Yeah, that was definitely just about 4 or 5 we just put up there as default. It's going to be customizable. It's like, where are you at in your life? What are your goals? And eventually we're going to have
Angela, I'm with you.
Yeah, a lot of almost like crowdsourced goals. Like you put your goal, other people say, "Oh, that sounds like a good goal," similar to me, and we'll start building, I guess, motivational journeys towards that outcome, whatever that is. You may just be getting over a surgery, and you just want to get back where you can walk to the door, or back 20 feet or something like that without.
Yeah.
I mean, like legitimately, there's certain levels that you can shoot for, and then we'll try to guide you to that. And later on, we'll be having competitions with other people in the same category. Almost like, I'm not going to say, it'd be handicapped in a way, just like in golf. You can compete with other people that are much better or worse than you, and you can still kind of compete together. So it'd be similar to that. You'll be trying to beat yourself, but at the same time, we're going to be introducing leaderboards with people of your similar chronic condition, where you can motivate each other to do better. To share ideas on what helps, what works, and really start to cultivate these patient communities as well.
And that's fantastic. Are you also going to be able to change your journey? Because depending on where I am, I would also like to change my journey.
Mm-hmm.
Yep.
Yeah.
You can do it already. I mean, you can do the settings. You can do it. And remember, the idea is we have assumptions on all these journeys and things, but it's the users are going to decide what they want and give us ideas, like what you just mentioned right now. So basically, anything is possible. Just let us know, and we'll factor your feedback in.
Perfect. Thank you.
There is something called as PAM score, patient activation measure. Do you guys know about it?
I've definitely heard of that.
Yeah, there's something called a PAM score. You might want to look at it and see if those criteria can be brought in to this whole process. I think it is something that there's 22 measures or 13 measures or something like that in there. And I think you might want to look at, I think it is a structured way in which they do it. So that will give us I know, Brennan, you wanted to develop this wholesome big score thingy, and that's when I started looking up things, and I came across this PAM score. I just wanted to tell you that.
Yeah, it looks like I've never clicked on this link, so I guess I didn't know about this. Is it from Insignia Health?
I mean, I saw it from PubMed.
It's a patient activation measure. That's what it is.
Yeah. PAM score, patient activation measure.
Yeah, it looks like a couple of different entities are implementing that score, that measure. So it's a commercial product which assesses an individual's knowledge, skill, and confidence for managing one's health and healthcare.
Yeah.
I'll look into that. Kind of sounds like what we're doing too, on a 0 to 100 scale. Yeah, thanks for sharing that. I'll definitely look into it. Yeah, and what we're trying to do is something I think a lot of people have been trying to solve, is to get an accurate health score for an individual. And up until now, technology just hasn't been there.
Mm-hmm. So there's different technologies. Like I was at the OSU conference recently, and I bought this machine, and I'm going to start testing my own ketone thing. And I bought this machine, and then basically, if I am in a state of nutritional ketosis, then I will get better automatically. I don't have to freaking do all these exercises. So if I'm able to burn my fat, that will give me a better measure. I'm going to try to start doing it, but my problem is, of course, I'm going. I track what I eat. I take pictures of all the things on the other app that I do, but this thing is not integrated in that. I'm just trying to figure out how I could, track over time and see how I'm going to change. It's like it's a little bit of a complex thing.
So you basically just want to track your ketone levels?
Yeah, I have to be in a state of nutritional ketosis for me to kind of burn my fat.
Mm-hmm.
So that's the whole idea of it. And if I'm not there, then I'm not burning my fat. So
yeah, I've done the ketogenic diet for a while. Do you just start to feel like you're literally on fire when you're in ketosis?
No,
That's the way I feel. Like I just feel like my skin is hot.
No, but it's your tongue changes, your breath changes, and then basically, if you adapt yourself over time and you get into a state of nutritional ketosis, then you will end up being become a fat something called as fat adapted.
Mm-hmm.
So I mean, I can talk a lot about it, which that is not the purpose of this conference, but I can talk to you offline on that if you want to know.
Yeah, I tried that for off and on about 3 months. It shed some fat off of you for sure. All right, let's see. So where did we leave off there? Kind of going over the wallet, the market, and vote. Journey, we pretty much covered everything.
I can add actually one more thing.
Yeah.
If you want. So, oops, time to get my phone here. So for all the metrics that you're seeing, the heart rate, steps, hours, etc., sleep, what we're going to try to do also is that right now we just see a little bit of the last 15 days, a little preview of the 15 days, past 15 days. But the idea is you'll be able to click on a button, have more details, but also have suggestions. So if you go to your sleep, you will have, your sleep, your last, quarter or year of sleep, a little bit of averages, kind of like what Fitbit does, etc. But the interesting part is we want to analyze that and tell you little suggestions like, hey, your sleep is not as good as what it should be. You're getting so close to your steps, but you have to do a little bit more effort. So little suggestions like this that are actionable notifications. So it basically tells you, it doesn't only give you the data, because I mean we can all read the data and a few of us can figure out what it tells us, but we will also analyze it and tell you a little bit of what we think you should do, to get a little bit better. So that's also coming hopefully soon.
How many suppose APIs are you ready to integrate in this whole process? I mean,
well, technically we can. I mean, we should be able to integrate the main wearables, anything that connects to Apple Health, pretty soon Google Fit also, and we can also do. I mean, we should. I don't know. Brandon, if you want to talk also about the clinical, data, getting the clinical data at some point, but you should technically, in the future, be able to even have your medical record, so from your provider portal. So is your question, what can we do right now, or what are we planning?
Yeah, because what would you do if I get you the API for this one?
Yeah, I mean, it's one of those things where if there's an API, we'll integrate it. And most of the time, the manufacturer has already added the API on Android to Google Fit, or on iOS to Apple Health. So it's already there. You just need to connect your Apple Health.
Mm-hmm.
So yeah, I mean, if you can send me directly, or put the link of that device, and I can tell you if it's already there. How
Keto Mojo.
They have an affiliate program. We could sell that on our marketplace.
There you go.
In fact, I have the connection to the founder. That's why I'll connect you up on it.
So these are also some interesting part of this whole app, that we're trying to introduce people to this kind of, diets, this kind of new discoveries. Sometimes we have to, we receive newsletters and we see something happening, but most of the time we don't know what's going on. And I think it would be interesting for everybody, all the users, to get those kind of notifications, or, a new device that's been included. Why is it there? What does it do? Can it help me, etc.?
Can you hook up more than one device at a time?
Yes.
Can you hook up more than one app at a time? The information, like from Fitbit, has one set of data, and then you have Map My Ride, or Map, and all those kind of things. The different apps that have different data sets. That can you bring all that in?
Yes. So right now you can only do that when you're not using Apple Watch. But again, if you're not using Apple Watch, you're using a Fitbit, you can pretty much include any of the other apps that come with this third party that is called the Human API that we use, and you can connect. You can pretty much connect Run My Map.
23andMe.
What's that?
23andMe.
Yeah, 23andMe and stuff. We don't use all the data yet, but it's data. It's data that we're going to use in the future. But in your specific case, like Fitbit does not. If you have a Fitbit that does not have a heart rate monitor, for example, but there's an app where you can log the heart rate, or you can log your bike rides. It's actually, everything gets consolidated, and then we get all the data from different apps. So. Yes.
How do you do that? How do you hook up more than one? I've tried to.
So if you look,
go ahead. I'm sorry.
So if you look at Add Data Source on top of the health score, there's a little blue, and you click on it. Actually, you have access to the ones that we're supporting, and you can actually add more than one. And if you go to the, I can't actually have it now.
Yeah, I have my Fitbit and my blood pressure stuff. Hook up to mine. So we're just not displaying that data right now, and it's not being incorporated into the health score, but that data is being gathered.
Now,
so I don't know if you can.
I did something, and it I went off onto something strange somewhere.
Yeah.
And now I can't get back. Let's just.
Yeah, that's a good point right there. I had somebody, Yuhan Sonnen, told me that from.
The back thing.
Agecraft, yeah.
Yeah.
Yeah, I think you were copying that email. Yeah.
Yeah, there is. So okay, so there's that bug where. So did you log in? Did you connect your?
Yeah, I'm connected with the Fitbit, and then when I tried to connect the what is this thing down here? The Apple Health, the Apple Health deal, that disconnected Fitbit.
Well, you can't. Okay, so
you do both.
Right now, you can only have either Apple Health or the Red.
Okay.
Yeah, or Fitbit. So this is something we're working on. Also, we want to make this whole process kind of more seamless, because right now you get that choice in the beginning. It says you can either choose the Human API, which is everything else, or Apple Health or Apple Watch, and that's it's going to get better. But to answer your question, yes, you should be able to add more if you're not on Apple Health, and you can go to the settings, and then there's at the bottom, you can switch from Apple Health to not Apple Health, and that's where you can add all of this metrics. So the cool part also is that we're not storing any of that data. So right now it's, just pull it whenever we need it. So, I mean, you can add as many data sources that you want. You just go directly to the algorithms and calculate everything and display the results.
Can I ask another question? What's your plans for monetizing this? What are your long-term goals? How are you going to make money with this?
Well, a couple different ways. From the user, we haven't even considered charging the user anything, because right now This is a part of our entire ecosystem that we're building. So we really want to get people motivated to go out there and start living a healthier lifestyle, and we're rewarding them with our cryptocurrency. Now, the marketplace is where we're going to make our money. That's where you do use your cryptocurrency, the meta that you earn, along with USD to purchase products, doctor visits and services and stuff like that. But one avenue that we're already been discussing, already had a couple conversations about, is putting Humantiv in a employer setting, like an employer wellness program setting, where it's just a simple leaderboard for their employees and go out there and track their steps and just have competitions on who's more active throughout the day. And simple, $2 or $3 per month per employee. That's pretty standard. And I really didn't think that, I mean, I would assume there was something out there like this. We really didn't build this for that, but a lot of employers do need something like this just to keep track of their employee wellness programs. Because we have one guy that's working on this project with us. He's an employer benefits consultant, and he mentioned one time that one of his clients, they took, at the end of the week, they took Fitbit readings manually and wrote it up on a whiteboard, and that was their leaderboard. So all we have to do is just create a web interface, kind of white label it for the employer, and you can just have all the employees just scores, their meta earnings, steps, quality of sleep, whatever metric they want to measure by. So that's one avenue there. We are already in talks of piloting this. We will be piloting this with a group of physicians out in Texas, and really whoever wants to pilot it, but to offer their patient population, just so they can start becoming more motivated to go walk more, get better sleep, and so forth. So as far as monetizing this specific app, I really just want to get it in the hands of people and using it and finding ways where it can provide value. But leading on to Metaplex, that's really, we're almost using Humantiv to optimize health and drive people to Metaplex when they do need healthcare services. That's kind of the progression of what we're planning on doing.
That's great. That's what I wanted to hear. That's awesome. Are you going to plan on advertising at all? I mean, are you gathering the data so that you have, like Facebook does? No.
No, we'll take it a step further. That's what our team meeting this morning was about. And this is something we really aren't, I guess, ready to make public, but we'll go ahead and talk about it now. Patient data is a big thing. People now are understanding, okay, these companies are using my patient data to sell, to advertise to Facebook, and what you just mentioned there. We do not want to do that, not at all. We actually want the patient to own your data. Like, I want to own my data. I don't want anybody to profit off of me unless I give them the right to do so, and I get a cut of that. So that's the idea. Is we're using. Take a step back. Okay, with blockchain technology, it enables us to create tokens, and it's really just digital forms of something of value. Well, now we can take your healthcare data and tokenize that, where you own it. And if, say, a pharmaceutical company wants your specific data to run some trials, you can actually say, hey, this is my data, this is my price on it. And if you want to access this, you can rent my data for a certain amount. And that's what we're moving towards, something like that, where each and every individual, they actually own their data. And if some entity, that you can delegate it out.
Amen.
That's awesome.
Yeah, that's really big. Like this week we kind of cracked something wide open, and it's a game changer. It really is. Like, everybody's trying to figure out what to do with patient data, how to manage that, how to let patients own it. Like, this is really game changing stuff. I'm really excited about it too. It's going to take us a while to get there because it's such new technology, but it's going to happen. Yeah,
that's exciting.
That's fantastic.
Yeah.
So you're y'all are negotiating deals with doctors and hospitals and different things that they can use. Is that what you're talking about with the Metaplex?
Mm-hmm. Yeah, we already have 2 pilot programs agreed to. One is with New Care MD in Jackson, Mississippi. It's a direct primary care company. He's branching off, having a few more different clinics, and they're going to be using Humantiv as for their patient population, also Metaplex And specifically Metaplex, for them, a primary care doctor, they have a hard time referring patients to a specialist under a direct payment model. So yeah, you can send somebody to a cardiologist or to a GI doc, but you don't know how much they're going to charge. And if their patients are operating under the idea of no insurance, then it's really difficult to establish that cash pay price. So we're developing out a way for these direct primary care doctors to really create their own referral networks under a direct pay model. So that's what New Care MD will be piloting out. And we're also doing the same, something similar for Green Imaging, which is a medical diagnostics company. They do a lot of imaging. And they have locations all throughout Texas. And they're in Alabama. Is there another state, John?
Atlanta. They're in Atlanta.
Georgia and Alabama, expanding rapidly. And we're going to be offering their imaging services like an MRI or X-ray or ultrasound, offering those on Metaplex where anybody can go purchase them for really cheap. I mean, you can buy an MRI for $250 versus $2,000. So that's the idea with that. And all this Humantiv, the health service tokens, these non-fungible tokens, Metaplex, all this is working together really to create almost like a collaborative operating system for the patients and the healthcare providers to come together. So really interesting.
Without insurance.
Without insurance, no insurance.
That's exciting. I mean, that is so exciting. I can't tell you. I've been doing this for 34 years, and it's this industry has gone crazy.
It is. We're trying to fix it. It's going to take a lot.
That's exciting.
Yeah, it's not going to. That's what a lot of people say. They say, "Well, you're kind of trying to boil the ocean," and not necessarily. We're strategically placing some nuclear bombs in places, but we're building multiple products and multiple platforms that can grow on their own right, but working together really solves a lot of the problems. And from my experience and my point of view, the biggest problem is how we pay for healthcare. Having these insurance companies, these hundreds of insurance companies and all the ancillary entities around them, that causes a lot of the problems, a lot of the frustrations, a lot of the irrational prices. Right. So if you cut them out and you just go with a direct payment model, it solves a lot of problems. And be transparent about it too. That solves the majority of the problems. Just be transparent about the prices.
Well, one of my favorite sayings is our existing healthcare system, certainly there are exclusions, but it's all about the Benjamins, and we are not all about the Benjamins. We're about healthcare from the physician to the patient, no interference.
Right.
Mm-hmm. If you look at our whole industry, it's built on the reactive sick care model. Like everybody profits more from people being sick. It doesn't need to be that way. Like I'm not against profit. People need to profit from keeping people healthy. That's where we need to go. That's what we need to focus on. So everything we're doing is trying to move in that direction.
Do you have any kind of hospital systems or any of the big ticket stuff that is interested at all or involved at all in this?
Not yet. We haven't reached out to anybody. Nobody's reached out to us. Really haven't had any marketing in that area. Trying to focus on that. Really focusing on your independent doctors, the ones that want to break away from the status quo and kind of go out on their own merit. That's why we're focusing on direct primary care doctors. And they're the ones that are fed up, and they're the ones that are striking out on their own to do something new, and they get it immediately. So we'll really be focusing on them a lot.
And I think until certain things change, Tony, it's going to be a futile effort to reach out to hospitals and health systems, because as long as they're able to generate facility fees of the orders of magnitude that they are, they're not going to be interested in this.
Sure.
There's not enough Benjamins in it for them. But of course, CMS just put the evaluation management codes on notice. That's going to be site neutral reimbursement come January 1, and I'm hoping they follow that up with site neutral procedural professional fee reimbursement.
Right, I agree.
I will say though, we did get some interest. I'm speaking at a conference in Nashville this coming week at Health Further, and there's like a clinician matchmaking event, and a few physicians reached out to me. One was from the Apogee Physicians. It's the first time I heard of them. It's hospital. It's a physician-owned hospital.
Okay, what do they want? Tell me about Apogee. I know a little bit about them.
Yeah, I'll find out. I think I'm meeting with them Tuesday, and they just want to know more about what we're doing. They just want to know more. So I'm kind of curious. 100% physician owned and operated. We'll see, but that's about the only, I guess, hospital you would say that it's actually reached out to us.
They're a hospitalist program. They're a hospitalist program that hires people and places people. And they don't own any hospitals. They are just
they can't. It's against the law right now.
It is right. Yeah, that's so messed up.
They're using doctors. These guys just take on doctors and they place doctors. The guys get on people with H1 visa, and then they place people around the country. They mooch up the doctor's sweat, and basically the hospitals need placements, and these guys find the doctors and place them somewhere else.
Right.
I've friends in the system that are their employees, but the problem is, they need placement, and these guys have hospital contracts. So it works out either way, both ways, but it just comes down to them mooching off the need and all that. So.
Okay, I'll keep that in mind. Hey, I didn't know anything about them. Like I looked at the website.
We can provide different solutions for them. We can talk offline. I have something I can tell you more about that.
Okay.
How about the surgical centers that are like the Oklahoma and stuff?
Oh yeah.
Yep.
Big targets.
That is good targets, and we're working. Had a few conversations with Cure Health out in San Francisco, and it's a K with a K, Cure with a K. What we're really looking at on Metaplex is the ability to bundle services, like a bundled price for a complete knee surgery, kind of like what the Surgery Center of Oklahoma does, $15,500 for a complete knee surgery. And for us to I guess, bundle up all the prices and all the services into one product, somebody like a self-funded employer can purchase this product. It really streamlines it. On the back end, everybody's paid automatically that needs to. So we are looking at that and starting with your musculoskeletal surgeries first. So if you want to look at what our first use case for Metaplex, it's really going to be for the self-funded employers and imaging, surgeries, and the direct payment model. I think that's the low-hanging fruit and really the easiest use case, the ones that they can immediately recognize and find value.
Right.
All right, everyone. Well, if nobody else has any questions or comments, we can go ahead and call it a day. Definitely appreciate everybody taking time today.
I just want to say, going forward for the rest of our testers that weren't able to join us today, especially more for the Apple people, look for version 1.11 or 1.11. That's the version where we are as of August 23rd. Check your emails, please, because it might have gotten lost in there. You'll also be getting this video. And of course, just keep your questions coming and communicate with us via intercom. That, of course, will be in your app. And we will go forward from there. But we are very much looking forward to your comments and questions and how we can make this a great experience for you. And
thanks, everyone.
Yeah, thank you all. Hey, I will say something real fast. Nabil, do you have an issue with like the actual test flight being updated? Because a lot of people say they get that email and they click on it, but they're just taken to the, I guess, the old build. I'm not sure. I'm on Android.
Yeah, I just had the 1.11 worked, but the one just prior did not. I got that.
Okay. Yeah, that's a very common problem.
We had this issue, and I had to look
and
at
she
it.
did a good job.
We had to look for it a little bit, and it's not straightforward. So we basically have to do some manipulations inside our test flight console before releasing things, like deleting the previous. It seems like keeping the previous version holds people who are using it. So now we have to delete it and then just publish one version for testing. So it should work from now on. If anybody has a problem, please let us know.
Okay. All right. Well, thank you all. and have a great
How
afternoon.
far did you walk,
Same
John?
to you.
Yeah, John, how far did you walk?
Oh, Lord, I don't know, but a good bit. I haven't checked Medit yet, but I'll let you know, Tony.
Cha-ching. Yeah.
Y'all take care.
Y'all too.
All right. See y'all. Thanks.
Bye-bye.